My name is Sue Wang. I am a physician at the Charles B. Wang Community Health Center. We are centered right in the middle of Chinatown in Manhattan, and so our population is Asian individuals, and a lot of them are new immigrants. Hepatitis B already disproportionately affects Asians in that it affects 1 out of 10 Asians worldwide. I actually have hepatitis B, so personally it does affect me a lot, although it's not how I ended up here, but because I ended up working here and we do a lot of hepatitis B work, for me it's really, this is something that a lot of the things that my patients went through, I went through myself. I think the problem with hepatitis B and C, and maybe why it hasn't received as much attention, is that a lot of people, when you just on surface, it looks like it affects not the mainstream, right? For Hep B, it looks like it affects more minorities. For Hep C, it affects IV drug users and incarcerated, minorities too. And so then people feel like, oh, it doesn't affect the mainstream. But actually, we've seen people who are, there are white people that get Hep B. There are a lot of young, old. It doesn't matter. Everybody's at risk, especially since it's so transmissible. It's 50 to 100 times more transmissible than HIV. So there are a lot of people who've gotten Hep B and don't know how they got it. Liver cancer is growing in the country. CDC put out a report that unlike other cancers like prostate and breast cancer, which are going down, liver cancer is actually growing in terms of its prevalence rate, and a lot of it is because of Hep B and Hep C. So it's really important for Hep B and Hep C communities and physicians to work together because it's kind of along the same pathway. It's a viral hepatitis that leads to cancer. So until we had the vaccine, there was no way of really stopping the transmission of it. Now that we have the tool, we have the vaccine, this is a real deal breaker for the disease in terms of we can stop the transmission. And hopefully, a quarter century from now, we won't be talking about the disease in the same way that we are now.